Good evening, everyone. Welcome to the first webinar version of or bootcamp version of BioMed Bhārat. So we are trying to facilitate something first time for the first time at the university level and at a national level, where we want to bring in different types of problem statements from the stakeholders directly, which is doctors. They have identified certain kind of pain points from the community, and we want to address them at a very initial level, for which we are looking at an open innovation model. In this model, we are trying to explain the need and necessity of that particular problem to be solved, and we are looking for innovators who can address the problem at a root level. So this particular webinar is focused and extremely spearheaded to delve into the problem understanding part. So it goes this way. Each of the problem statement will be explained from the two sides of it, both in terms of the doctor's version and in terms of the technology version. So participants make use of it. If you have any specific question related to a problem in terms of medical perspective, our doctors are here to help you dwell into the problem in a much more deeper way. In terms of technology way, we have experts from technology background who dwelled into that particular problem and collected some insights readily available for you. So I would ask every participant to make use of this session. If you have any question, uh, don't even think about whether it is a small problem or a big problem or whether it is the right thing to ask. Forget about all these things. No judgmental, no bias in terms of whether it is a small question or a big question. We are here to answer your queries. So for the first 5 to 10 minutes, each of the each of the problem will be discussed on a brief basis, followed by we will open for the Q&A part. You can log in all your questions in the during the session or post the session in the Q&A session. If you have really a burning question that needs little explanation, you can drop in a message. Then we can pull you into the panelist, and you can express your question in a much more detailed way. Looking forward to have a wonderful session in terms of valuable insight sharing from doctors and recepting the same to the participants. Wish you all good luck and all the best.
Right, Raja. Thank you. So first, let me. This is Ravi Kishore. So let me just set the context here for all the attendees here. First, thanks for attending this session. The context is this: GITAM University, which is spread across the 3 campuses in Visakhapatnam, Hyderabad, and Bangalore, has departments across all the disciplines, including medical sciences. So we want to do, we want to initiate top-notch innovation exercise in the the need of our, that is biomedical device design in the form of a hackathon, and that is how the problem statements are been created, which as I was mentioning. To be sure, the problem statements initially they may seem to be difficult, but the context, the main important point is this: all these problem statements have been really went through a churn of all the faculty members of both engineering side and sciences side and medical sciences side, and these problems have been taken up. These are very relevant problems to the Indian context and challenging problems. That is the reason why we did not put any registration fee, and the panel, even the prize money is good, and we want to really hold the participants to participate actively, fully in this innovation exercise. Our intent is that we want to form the best talent to come here and compete in the best way, so that the winners come out with the best innovation, concept. That is the intent. Now there is so this is the context, and we want to now go forward. I see the first question coming in from Srimai. How to form a team. So this is if you see the brochure, we have just mentioned that the participants should be students from higher education institutes. That is the only constraint we have put. What it means is that we have given a lot of flexibility to the participant students, that Some students their students need not be from the same institute. They can form teams across the campus, across the institutes, and form a truly multidisciplinary team, so that the best teams can put their innovation capabilities to the work, so that the best device come in. So that's what it is. So it is up to you on how you can actually form the team across the campuses and depending on your network. Hope that answers the question. So now I give the floor to the GIMSR and the GST faculty, each of whom will be explaining the problem statements. Okay, over to you.
I hope this is visible to all.
Yes, sir. It's visible, sir.
Okay, we'll go with that. So the first problem statement is to design a device that will allow us to monitor the levels of glucose in the blood in neonates. And neonates are very, very young children. Now, in a normal person, the blood glucose levels are in the range 80 to 120 milligrams per deciliter. Diabetics have higher levels. So neonates that are born to diabetic mothers have a variety of potential complications. So it's important to monitor their blood glucose levels. And as Madam will explain later, if you use the current methods for monitoring the glucose levels, even if they are minimally invasive, you find that it causes stress in the infants. So what we would like to have is a device that would allow us to monitor the blood glucose levels in neonates in a non-invasive manner. The difference between invasive means you withdraw a sample of blood. Non-invasive means you are able to obtain the information regarding the blood glucose levels without puncturing the skin. Now, there are certain methods that are known as minimally invasive, in which case you do very, very minimal puncturing of the skin using microneedles, which has little or no pain. Okay. So, but here the problem statement is regarding non-invasive blood glucose monitors. So not invasive or minimally invasive, they will not be considered. Okay, so how do we monitor the levels of glucose inside the body, inside the blood, without puncturing the skin, without withdrawing blood? Okay, so there are of course many technologies for that, and that's what you have to come up with. The participants have to come up with. But in this tech exposition, basically, I will give you a brief idea regarding the different methods that people have tried so far. Okay. So the device is generally called a biosensor, and these are the basic components here. First, it has a biological sensing element. That element has to be sensitive to what you are measuring. In this case, glucose. That signal has to be transduced, meaning that whatever you measure has to be converted into an electrical signal. Normally, this signal will be very weak, so you have to amplify that signal. And of course, that amplified signal has to be either recorded or transmitted or displayed. So these are the basic components that will be required for almost any device that you build as a response to this challenge. So let's take a look at what others have done. Now, although what we want is the level of glucose in the blood, you don't necessarily have to monitor the level of glucose in the blood. You can use other body fluids as proxies. What proxy means is that if there's a high level of correlation between, say, the blood glucose level and the glucose level in interstitial fluid, you can simply measure the glucose level in the interstitial fluid as a proxy. Okay, if there's a high level of correlation between the level here and the level here, then you measure this if it's easier for you to measure this rather than measuring the blood glucose level. So that is also permitted. What we want is the end result, that whatever measurement you make has to correlate with an invasive blood glucose levels. Okay. So the fluids that have been suggested as proxies for blood are sweat, tears, interstitial fluid, saliva, and even urine. Urine has very low correlation, so that's not medically relevant. Sweat, tears, and saliva have some low level of correlation, but they are also not very high. Interstitial fluid does have reasonably high level of correlation with the blood glucose levels. So that is a very good proxy for blood. And actually the only non-invasive blood glucose monitor that has been approved in both USA and Europe is based upon monitoring the interstitial fluid level, glucose in interstitial fluid. Okay, so what are the different ways in which you can monitor glucose non-invasively? People have suggested and people have tried many different methods. I'm not going to review all of them here. Obviously, it's not possible, but I'm just giving a kind of a quick overview of the many different ways in which you could actually monitor the levels of glucose in blood. The first one is what I had just mentioned, is skin patch and electrode. A skin patch is basically a patch that you attach to the skin. It's still non-invasive because it's not penetrating the skin. Okay. Then by using a technique known as iontophoresis, where you apply a potential across different parts of the skin, you withdraw glucose from what's known as the interstitial fluid. Interstitial fluid is basically fluid that's present just beneath your skin. Now, as I said, this glucose level in that interstitial fluid correlate with the glucose levels in the blood. So if you can measure that, then you have an estimate of the blood glucose level. So how do you estimate that? First you withdraw the interstitial fluid using, say, iontophoresis or sonophoresis, and then you estimate them using electrochemical methods. So electrochemical method, basically what it does is it will oxidize glucose. Okay. And when you oxidize glucose, the electrons that are produced there are used to generate a current in the electrode, which that current will be amplified, of course, and sent to a recorder, some device. Okay. Another way of doing this is to use a breath analyzer. Now, high levels of, whenever you have glucose in the blood, if you have high levels of glucose, whatever is produced by metabolism of glucose, high levels of that compound will also be produced. Okay, so it turns out that there are certain ketones that have higher levels when there's an elevation of the blood glucose level. Now, the advantage of the breath analyzer is obviously that you simply measure the chemicals in the breath. So by measuring the content of the breath, you get an estimate of what is in the what is the level of glucose in the blood. Again, the correlation is not perfect, so that's where the problems are. Okay. More direct methods of measurement use electromagnetic radiation or ultrasonic waves. They are based upon either reflectance or interference or transmission. So basically, suppose you can use near IR or mid IR light. You shine the infrared light, it passes through tissue. Some of it is reflected. By measuring what is passed through or what is reflected, you get an estimate of the glucose that is present in your blood. Okay. So similarly, you can use absorption of electromagnetic radiation. So if you use near infrared radiation that's absorbed at wavelengths which glucose absorbs preferentially, but water does not, you can get some estimate of the blood glucose levels in your blood with her. So the wave and the electromagnetic radiation that's near infrared light goes into your say earlobe or say finger, and it's totally non-invasive. That's another method. Another method is based upon polarization. Polarization is the property that glucose is optically active, so it rotates the plane of polarization of light. So light that if high glucose is present, the plane of polarization will be rotated more. Okay, so that's another way where you can shine light, observe the light that's coming out, and measure the plane of polarization. The problem with that is, of course, scattering of light is also there by other tissues, so that even if you use polarized light, the light that comes out has a low degree of polarization left. Another property is fluorescence. Fluorescence is the property where you shine light at one wavelength, and whatever absorbs it will emit light at a different wavelength. The advantage here is that the background radiation, so if you're using absorption measurement, you are using a single wavelength. Fluorescence is more selective because you use one wavelength for excitation and one for emission. So by being able to select two different wavelengths, you have higher degree of selectivity, so you can focus on what you want. And the background radiation from the tissues, skin, and everything else can be reduced. But the disadvantage here is that you have lower sensitivity than absorption measurements. A similar method is Raman spectroscopy. In Raman spectroscopy, you shine light at one wavelength, usually in the infrared, and you observe the Raman bands, which are generally weak, but they are highly specific for the substance of interest. So by detecting those Raman bands, you don't have to worry about the hundreds of other biochemicals that are present in your body. But
So,
again,
Professor,
yes,
Professor Shekhar.
yes, sir.
So let's do one thing, because this is a bit detailed, and we'll just pause if there are any questions coming in. And is this for only the first use case, I mean first problem statement, or others are also covered in this? The first one.
This is first use only, sir.
Okay. So let's do one thing, because considering the time, because they only 1 hour time. So what I would suggest is we can quickly conclude this, because now we mentioned our high level. So my submission or my request would be that if there are other important points that we can cover in the interest of the time, we can conclude this, and then we move to the other problem statements. And if there's anything, if there are any questions, as it is, I did not see anything from the panel. There's only one question I see, that can you share the recorded video of this webinar to the mail? Shashi, is it possible?
Sorry, didn't get you, sir. Can you repeat?
The questions, one of the questions says that can we share the recorded video of this webinar?
Yeah. Definitely, it would be uploaded in the website as well.
Cool. Okay.
Okay. So you just 2 more minutes, sir.
Yeah, sure.
Okay. So as you see, there are a wide list of different methods by which you can monitor blood glucose. Now you may be wondering why, if there are so many methods, why do you require another method? And why nobody has approved a non-invasive blood glucose monitor so far? Okay. The problem is, there are actually many problems. One is, and there's a list of things that you have to take care of before you can get a non-invasive blood glucose monitor that is useful in a clinical setting. Okay. First, linearity means the response has to be proportional to the blood glucose concentration. Precision. So these are the different types of things that you have to take care of. It's listed here, and you can look up what all of them mean. And these are the sources of variation: temperature, humidity, hematocrit, oxygen. All of them can change the response of your instrument. You have to take care of all of these before something actually becomes can be used in a clinical setting. Okay. So since this PPT will be shared, all you have to do is take a picture, and in the problem statement, if you click on those links, you will get you'll be directed to reviews that give you information regarding the different methods that have been utilized. And of course, some of these things you will have to read. And another useful source is the patent the approvals. So if you go to the FDA website, as I said, there's only one device that has been approved for non-invasive blood glucose monitoring. If you go to their website, they will show you the principles of this method, all the tests that it has to pass, okay, etc. So that gives you some idea regarding what you have to do to make it clinically relevant. However, for the purpose of this, I think if you have a device that is linear, has high precision and accuracy, and at least in principle, you don't have to demonstrate all this. At least in principle, it will not be subject to variation from the common confounding factors. You will be a candidate that will be admitted into this competition. Okay, so just worry about linearity, precision, and accuracy for now. Sir, any questions I will answer?
Yeah, so I also would like to mention that for the participants, for the benefit of the participants, that you can, there's an email handle given, so you can actually send your all the technical questions. We'll be monitoring it, and the questions will be shared with the relevant experts, and the questions and the answers will be given, even if somebody is not participating in this webinar. Or if you are taking up the questions later, as you go through this and in detail, and if you have the questions, those questions can be addressed to that email handler, and the answers can be provided at the earliest possible time. Okay, yeah. So thank you so much, sir. So we'll move on to the next. Okay,
sir. If Lalita ma'am has anything to,
I'm not sure. She, Lalita ma'am,
yeah, she's here. She's here. Yeah, she has a presentation as well. So Lalita ma'am, you want to go through your?
So you can just present that. I think anyways, Shekhar sir has covered the maximum, whatever I was supposed to say. Maybe from the medical aspect a little, if they would want to know, they would be there in the slides itself.
Yeah, and just I'll go through this.
Yeah, maybe in the next just 2-3 minutes you can quickly cover.
Yeah. I think this is the slides.
This is the main slide. Yeah, you can present it.
Ma'am, you can. Ma'am, over to you, ma'am. Yeah.
So regarding this problem statement, as we have all heard, Shekhar sir. So we are here. So why is this problem statement or problem important to address or to find out a device for the same? So coming here, all of us are related to women in one or the other way. Let it be our mother, sister, friend, cousin, or colleague. Women of this generation are strong, hardworking, and competitive in all the fields. Working women, may it be work from home, based out of home, or a homemaker, has a lot of stress factors around. So during pregnancy, a woman has a varied lot of stress factors. Adding on to the stress factors, they might be genetic predispositions, physical health, PCOS or PCOD. These are all affecting a woman adversely and might lead to risk factors like gestational diabetes, gestational hypertension, etc. So early stage deductions are, if a mother is suffering from gestational diabetes, baby born to a diabetic mother is a big baby. A baby is big in size, usually not the routine size or not the normal size, which is about 2.5 or up to 3 or 3 kgs. But this baby might be 4 or 5 kgs also, who might have birth complications because of the size. The babies also have metabolic disorders like high glucose levels, which are dangerous, and also low glucose levels, which are even more dangerous. The babies can have cardiac disorders, breathing problems because of low surfactant. In all of these complications in the baby, sugar levels play a vital role to stabilize the baby's condition immediately after birth until 1 week after the birth. So to check the blood sugar levels randomly, which has to be done over a period gap of every 4 hours after birth, the baby has to be needle pricked on the sole of the foot every 4th hourly. So coming to the complications, in all these complications, the sugar levels, as we have discussed, play a vital role. And the 4 hourly blood glucose monitoring is supposed to be done for stabilization of the newborn baby. And this process, as we all know or can imagine, would cause a lot of pain and inconvenience to the baby's delicate skin and body. to overcome this pain and suffering of the just born babies or the newborn babies, we would want to devise a non-invasive device for the SEAM, RBS, or random blood sugar monitoring. So coming to the numbers and outcomes, I think Shekhar sir has already covered all these points. So what and all have been there till now, which have not been, not been successful till now, and what is going on right now, the transepidermal water loss process. It's a project which is under process, which has already been covered or shared in the previous slides. So over to you, Shashi Garu.
Yeah, thank you, ma'am. Thank you. And shall we move on to the next problem statement?
So what I would suggest is from now onwards, each problem statements 5 minutes each. I think we should be able to cover. And
yeah, over to you, Raghu sir.
yeah, so the next one, the problem statement.
Automated device. Yeah.
Yeah, who is taking it up?
Yeah, Raghu sir.
Hello.
Yeah.
Thank you, Dr. Raghu. Please go ahead. So 5 minutes if you can.
So my problem statement is this is a portable audiometry device which I want to highlight few things. This is a portable and to measure the degree and type of hearing loss in the patients, and this is more of like an outreach device. So if you want to do a mass screening, we want this portable audiometry device to screen the people for those who are suffering from the hearing loss or hearing deficit. And the main concern for us is to develop such a device such that we don't need an closed room or a soundproof room. So we need a portable audiometric device without the need of a soundproof room. So this is my problem statement, and if at all if there are any doubts, I'll be ready to help you out. Over to
Harshvardhan
Shishir.
sir, you need to discuss anything from the technical point of view?
Yes, sir. So,
yeah.
Good evening to one and all. I am Harshvardhan from the engineering standpoint of view. So, I think Raghu sir has covered the main idea. See, it's a hearing assessment test actually. If you look into the main overview, so sir has pointed out that main idea. Let me start my video as well. So am I visible right here? So if you see, it is a main portable device. So two things it has to identify. First one is degree of hearing loss, and what is the type of hearing loss also. So mainly the output should be a audiogram device which needs to be plotted. So as a medical standpoint, sir has said that ultimately it will be using for masses, and it will be used to find out what type of hearing loss. But as an engineering point of view, we have to worry about what is the input and what is the output. So I will be talking about that. So first of all, input will be in tone frequencies, and the output will be an audiometric thresholds for each of the tone frequencies. That is as simple as this. But it's already a lot of devices are there. Okay, components are there. But main idea why the reason of giving this specific topic in this hackathon is to develop a portable device. Okay, and less latency device. And next one is how accurate the device is. So these are the three main things anyone has to focus whenever they're trying to develop any of the prototype or developing any of the concept. So these are the things you need to keep in mind while you are trying to develop these kind of prototypes. So I suggest you to keep these points in mind, because how you are going to develop, there might be different possibilities and different ways of doing that. You can come up with a hardware prototype, or you can come up with an app. So it's up to you, but ultimate target is, as sir has said, so it should be a portable, and it should be an accurate, and it should be a less latency or the fast device. So as an engineering, that is my idea. So keep these three things in mind, and think about different ideas. So those are the points from my end. And so if you have any Q&As, I'm always welcome. And yeah, that's it from my end, Shashi.
All right. Thank you, Chanakya. Thank you, Harshvardhan. Thank you so much.
Thank you, sir.
Thank you, sir.
Yeah, so then we move to the next one. Next problem statement from GIMSR team.
So shall I answer?
Ramna Rao sir is here. The next problem statement.
Namaste, India. I'm Dr. Ramna Rao. Shall I start the third problem statement?
Sir, this is Padmini. Hello, everyone. PS3, problem statement 3.
So I think Dr. Ramna Rao garu will speak, or you would...
Sir, actually, he was a panel member, but due to a technical reason, he is not in the panel member list now. He's in the attendee
No,
list.
he's here. He's here, ma'am. He's actually
Okay,
speaking.
yeah.
Yeah.
Yes, Prachiji, he may proceed.
Right.
Thank you.
General rule is just together for this problem statement from both the medical standpoint and engineering standpoint is about 10 minutes, so that we can cover everything. And see
Right.
Go ahead.
I'm just presenting the sharing the screen to you. So my our problem statement is to design and also fabrication of a shield to reduce the discomfort, pain caused during intramuscular injection, and also to avoid damage to the vessel and nerve which is present underneath the muscle. So description is, our main objective is to evolve anatomically and radiologically appropriated site determining 3D printed latex shield. If designed and mounted to the syringe tip, it will influence the outcome in a positive direction by avoiding the neurovascular injury and also discomfort. To use, another point is to use a relevant manufacturing process to fabricate and design the product, and also examine the prototype after during testing. So I'll just show you the picture. So usually what we do is we just make an inverted triangle, making the base that is of the shoulder, that is acromion process, and from there we go around 5 centimeters below and inject the needle of the syringe at right angles into the deltoid region, that is shoulder muscle region. So during this process, if the needle goes beyond say 6 or 7 centimeters below, or if it goes around, or if it is injected at around 2 or 3 centimeters, it is there is a possibility of injuring the underlying neurovascular bundle, the nerve and the vessels which are present underneath the deltoid. To avoid that, we want to design, our problem statement is to design a guided instrument which is made up of either using any of the appropriate materials and which are flexible. We attach them to the shoulder region and that guides us to inject at a appropriate region in the deltoid region. This is also applicable. We can, if we are successful in evolving a technique here or an instrument here, we can even use it for a gluteal region, that is in the buttock region also we can use similar such modified instrument, and we can use it. So how would it be useful for the medical practices? Most of the nurses, they give injections with their experience, but this will be guiding them properly to appropriately give the injection at the site. And another thing is, if in cases, already we have all seen COVID, wherein most of the nursing staff or doctors are not available. So even this instrument or shield mounted to the tip of the syringe can help people who are not medically trained also can use and inject the proper medicine in a proper way, not injuring the nerve and vessel beneath the muscle. So this is actually the main problem statement. And the expected outcome is to design a shield and integrate it to the tip or associated with the syringe tip, so that you can avoid the injury to the neurovascular structures, that is nerve and vessels which are present beneath. Some of the references are here. So this is it. This is the problem statement.
So I would like to add a couple of points here, sir, to everyone in the meeting. Number one, 3D printing is just one option proposed. Any manufacturing process which will definitely give out the outcome after, similar to the deltoid muscle, a triangular shield or a tip which surrounds the injection end. So even that would do. 3D printing is just a proposal. Any preferable manufacturing procedure can be implemented here. 3D printing, because it can be done easily, it can be customized. So 3D printing is proposed here. Any other proposed method or any other customized method can definitely be used here.
But
So this is something which I thought of adding on.
yeah, but at the same time, ma'am, considering the competition, because there's an open competition and expanding, inviting all ideas from every side. Obviously, the implementable and the relatively cost-effective solutions will be preferred, because ultimately, when it comes to the competition and the presentation before the judges, these points need to be considered, and most importantly, this being an India-relevant solution, a frugal innovation is certainly preferred. So I just want to
Yes, sir, perfectly well compiled and expressed. Thank you so much.
Yeah, so we will go to the next problem statement.
Stop sharing, sir.
Yeah,
Yes,
sure.
sir. Yes, sir. Shanti ma'am and Monisha ma'am. Yeah. All right. So should I share your presentation, Monisha ma'am?
Yeah. Shashikar, go on.
Yeah.
For 10 seconds. Actually, the problem statement from the gynec side is a portable device for the monitoring of fetal movement count. Why is it important, actually? Right? Share this. Why is it important? The fetal
Can we
movement
go to
monitor?
the presentation mode? Possible? Yeah, thanks.
Because fetal movement has long been used as an important factor and indicator in the fetal health and neurobehavioral development of the fetus. The assessment is accepted as a method for identifying the adverse pregnancy outcomes like intrauterine growth restrictions, like the baby is not up in par with the regular normal expected growth, and oligohydramnios means reduced volume amniotic fluid which is there in the amniotic cavity, and stillbirth is like sudden intrauterine death or death event during the delivery. So the issue of concern is like whether the patient is perceiving, the mother is perceived decreased movements, or actually the fetus is having a decreased movements. There will be a lot of confusion for most of the antenatal mothers, especially in a patient who is a first time pregnant. Okay. So some of the fetal movements can be general body movements or kick movements, stretches, sometimes the stretch of the limbs or rotation of the body, or twitch movements or limb movements. There is a normal variation in fetal movements with a wide range in a number of movements per hour. Like in a primate, usually 10 to 12 movements in a day. Ten to 12 movements in a day is considered as the normal movements in a daytime. Okay. And clinically important daily fetal movement count is an important fetal parameter in the fetal well-being. it is the easiest and most available method for evaluating the fetal condition. It is a subjective maternal perception of the fetal movements, and fetal movement is one of the first fetal sign sign of life in the fetus. Okay, fetal activity indirectly measures the CNS integrity and the function. Regular fetal movements can therefore be regarded as an expression of fetal well-being. Pregnant women usually perceive the first fetal movements from the gestational age of 18 to 20 weeks. So whatever the device which are going to use, it should be after the gestational age of 18 to 20 years, 20 weeks of gestation. So why there is a disparity in the actual fetal movements and the patient perception? Because sometimes mother can be a busy or anxiety whenever the placenta is located in the anterior uterine wall, implanted in the anterior uterine wall. Prior to the 28 weeks of gestation, there are reduced fetal movements or hyperglycemia or hypercarbia. Those are the certain factors affecting the fetal movements. And the fetal factors are actually natural fetal sleep pattern will be there. And sometimes in a pathological conditions like placental insufficiency, intrauterine growth restriction, and in neuromuscular anomalies like anencephaly, oligohydramnios. These are the factors in which there is a reduced fetal movements. Why we are more concerned is a decreased fetal movements is an alarm for fetal death. So these are some of the studies where they show the strong correlation between the decreased fetal movements and the adverse outcomes. Like 40% of the pregnant women with the decreased fetal movements, one or more times in the pregnancy, and 55% of the cases, stillbirths are associated with decreased fetal movements. So these are the routine, next slide, Shashi. These are the routinely how we monitor the fetal movements. We'll advise the patient to monitor the kick chart, to write in a charting, like kick charting. Whenever there is a decreased fetal movements, we advise the patient to come to the hospital and do the cardiotochogram, which is the correlation between the fetal movements and the fetal heart rate. If it is abnormal, like non-reactive stress test or anything, then we advise the patient for ultrasonography, biophysical profile, and Doppler studies, which are more reliable. But these will take a lot of time for the patient and the clinician and manpower, and the cost also will increase. So our expected outcome is a newer device, which is a wearable, cost-effective, and it should have a mobile app to store the log of the daily fetal movements that should alert the pregnant woman if the count is too low, and should send the message to the obstetrician, whose details can be pre-programmed in the app. Okay, these are the certain methods which are under study, like non-invasive fetal ECG, like piezoelectric crystals, using piezoelectric films for the pressure changes in the intrauterine cavity, and strain gauges for the forces, and all these things. These are my reference articles, and it's one of the CTG machine which is available in the antenatal wards. This is the newer devices which are under study. So from
Shanti ma'am, do you want to add anything?
Yeah, very good afternoon, everyone. From a non-medical perspective, from a technology perspective, ma'am has very clearly explained the medical perspective of this, why it is required, and what action needs to be taken and things like that. From a technology perspective, what needs to be done is that there needs to be some kind of sensing of the baby movement, recording of the baby movement, maybe hourly, how many times the fetus moves per hour. And then this should be stored, this data should be stored, so that, because each fetus has a particular movement pattern. So typically what doctors advise is always count the fetal movement at the same time during the day. Initially, when the device is strapped onto the mother, it should train itself for a few days, meaning that it should count the number of movements. When you're sensing the data, sense it for the same time for a few days, and then create an average number of movements per hour at a particular time of day, meaning, okay, from 12 to 1, the average number of movements is so and so. From 1 to 2, the average number of movements is so and so. So this is the initial data that you need to log and store. Later, this data will act as the ground truth. It will act as the baseline for you, for that particular mother and fetus. And so your device will keep on sensing, and it will keep on counting, probably using some kind of microcontrolling device. And then it will count. And then when the count goes below a particular threshold, which you had previously set based on that mother and fetus, so there should be some kind of an alert. So this, so there is a sensing component here. There is a data storage / data processing component, and there is also a data communication component where you need to send the alert to some nearby device or whatever. So these are, or you can have the alert there itself. So these are the 3 aspects that need to be there. So there needs to be sensing, some kind of storage, and based on that, some kind of inference, and so the device has to work based on that. So that is, as far as technology is concerned, this is these are the bare minimum things that you will probably have to put in. So thank you very much.
Okay, thank you, ma'am. Over to the next problem statement. Rajkumar sir. Rajkumar Sahu.
Sir, my problem statement is that we should devise a portable device which can detect organisms from an wound or an abscess. Basically, our target population is mainly diabetic patients and those who present with acute infection and abscess, so that we can treat them as fast as possible, because they are the one who are very prone to infection and are immunocompromised. So their treatment is usually delayed because our normal microbiological and biochemical test needs time, minimum of 48 hours. So if we can really devise something which can sense the bacteria in whatever way we can, whether from the order or from the wavelength picked up by the device or some other way, so that we can give them a proper treatment rather than waiting, rather than the lag period of 48 hours, which will be helpful in 2 ways. One is they can get the appropriate treatment and need not wait for 48 hours. Moreover, we can save them from the resistance to the antibiotics, which is more prevalent in these days. The third is it will be cost effective to the patient as well as to the hospital, related to the purchasing of antibiotics unnecessarily, which could have been prevented if proper antibiotic would have been given at the point of detection itself, rather than giving some antibiotics and waiting for the susceptible organisms to be targeted after 48 hours of culture report. So this is my main aim of putting this topic for discussion.
Thank you, Dr. Sahu.
Yeah.
All right. So somebody is taking up from the GST side, Shashi?
No, no one, sir. No, we can address the questions.
Okay, now
if there are any from the participants, if you have any questions, please.
Shashi, there was a question when we were speaking. So how many days do you need to store the data? That depends on literature. Please go through literature. Typically, how many days is required to actually find the pattern for fetal movement? It will be in research papers. You can find it in the net somewhere.
Any other questions from the participants?
Okay.
Are there any questions, sir?
Yeah, I think
regarding the first problem statement, at least.
Yeah, we'll just wait for 2 to 3 more minutes. See if we have we get any questions.
Yeah.
And then we can conclude.
Yeah, correct.
So any, yes, sir, continue.
Yeah, so basically I see that there are about 24 participants. Hopefully there is some registration process where we can see where they're participating. But anyways, I would say that at this point in time, thank you so much. This is the first and initial orientation session, just to get acquainted and to tell the participants and the students and faculty members from other institutes who who want to participate in this event, that there is a team and GITAM team is actually there to clear the questions and give the orientation session and these problems and give and encourage the students to participate in this competition. So that's the main aim of this session. I think we have done good, Shashi. Further, any other question, as I was mentioning at the beginning, please send it to the email handle given in the brochure and in the website. And those questions will be taken up. We hope to answer within 24 hours, depending on the, we hope to answer within 24 hours. That's the target we are putting. Yeah, I think from my side, that's about it.
Yeah. Yes, sir. Thank you. So, Raja, do you have any points to add? Or, Raja?
Yeah, Raja is not there, I think.
Yeah. Sorry. So that's it for today, I guess.
Yeah,
So
I think,
for all the, for any queries. Just a second. Yeah. So for any queries, questions, anything on your problem statements, might be from technical side, medical side, or anything, just the process of the registration, anything. If you have any queries, participants, you can send your queries to info.biomedbharat2024@GITAM.edu. And for any updates, please go to our website, biomedbharat.gitam.edu. Live updates are updated in the website every day. So please access the website. Yeah, that's it from our side.
So,
Shashi, there is a question that says, can we work on our own problem statements? Ravi sir?
No, absolutely not. No. We have these are the finalized problem statements. We have multiple discussions with the doctors and engineers, and we have shortlisted and come up with these five problem statements. There is no.
And these problem statements have a very clear purpose and goal, and that is the reason why we have taken up. And because these are all, we know that these problem statements are a little bit, challenging, and that is the intent. We do not want to make them too easy, and most importantly, we want to make them relevant for Indian context and make it pan-India, so that the best innovation, comes up to solve this, compelling and challenging problems. One thing I want to tell, at the beginning I mentioned, but again I want to mention that the most important flexibility that this competition is giving to the students is that the students need not be from the same institute. They can form teams across India. They just need to be students from a recognized higher education institute. They can be any multidisciplinary team, and they can come up with the best, innovative solutions. That is the flexibility that we are giving, and I think that is a fantastic opportunities to for the entire India to work on this problem statements. So, let the best teams compete. That's what we can do.
Just to add one more point, the team must be and then only students only, no mentors or as professors or assistant professors. They can't be a part of your team. They can mentor you, but they can't be a team member.
And also that is the reason why we have a GST panel of experts from the GST and GIMSR. That is a medical college and engineering college. Send the questions if you have any, and we want to. But the filtration process will be, will be decided by the the judges, and they are there to mentor until you come to the next stage of the competition. But once it is there, it is, it's one single platform for the evaluation process. Okay.
Thank you, everyone.
Yeah. Thank you, everyone from the GST team and the GIMSR team. Thank you so much for the participation.
There's another question. Sorry, there's a question.
Oh, there's a question.
How many final teams will be selected for the following? And will yeah, the bill of materials would be. Please go through the brochure or go through the website. All the details are provided over there. The bill of materials of your project, if you are selected for the further rounds, is provided by us.
So, so to answer the specific point on the how many final teams, that will be decided by the pre-final team, which is the evaluation team, which is doing the pre-final, and it doesn't have to be, 2 teams, 3 teams, 5 teams, etc. But the most important point is that that entirely depends on the evaluation team. And second thing is that it also means that you will be evaluated based on the bill of materials that you are giving, and because this whole point is about the frugal innovation, one of the important points. So that also will be considered as one of the factors. Okay, because we are actually supporting for the, depending on the cost and other things, we'll be supporting for the bill of materials also to provide to come and build the solution here. Even to that facility is also being given. Okay.
Yes, that's it from my side. So,
right.
Thank you.
Yeah. We can conclude the call, Shashi. Thank you very much. Thank you, everyone.
Thank you, sir. Thank you.
Thank you, sir.
So much. Right.
Thank you, sir.
Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir.